New Mexico Cancer Center and Health Specialists of New Mexico are the proud sponsor of Health and Wellness on New Mexico Living.
Hi, I'm Barbara McAneny. I'm a medical oncologist, a cancer doctor, and I'm the CEO of New Mexico Cancer Center.
My name is Karina Ochoa, and I am a pharmacy technician at New Mexico Cancer Center.
There are several different categories of cancers. The common ones come from gland tissue, like breast or prostate, but sarcomas come from muscle or bone. And a cancer is a cell that's growing out of control. No respect for what the rest of the body wants or needs, it just grows. So if a muscle cell or a bone cell starts growing out of control, that's what a sarcoma is. The treatment of sarcoma has evolved over the years. Surgery is still the main way that we treat sarcoma. You have to take it out. But the key of taking it out is to do as least damage to the patient and the function of the place you're taking it out, like if it's an arm or a shoulder. You don't want to make it so the patient can't use that limb. So surgery has to be done very carefully by someone who has a lot of experience in that particular type of a cancer. And these are rare cancers. But often we will add radiation and sometimes chemotherapy to shrink the cancer down so that when they do the surgery, they don't have to take as much tissue out.
I had terminal sarcoma when I was 19 years old. So it really shaped who I became as an adult. And I was pretty much stuck in hospitals for a few years. And I think it's made me a lot more compassionate and understanding. And it's also made me a lot stronger, both personally and also as a technician, because I can stop what I'm doing and actually put myself in our patient's shoes. I just wanted to make it really clear that a cancer diagnosis does not mean that you're going to die. I mean, I've signed so many papers and so much paperwork telling me that the worst possible side effect of all the treatments that I did was death, and that it might not work. But with all the advancements in science and all the caregiving that we do, I mean, you can survive. I did, and thousands of other people did, and you definitely can. The physical part of having a sarcoma, it required a lot of physical therapy. It was in my right shoulder, and I'm right-handed. So it did require a lot of physical therapy. Like Dr. McAneny had said, they didn't want to take out too much. So I did do radiation first, and it did shrink it down a bit, but I mean, there's only so much you can shrink it down. The emotional and physical journeys of chemotherapy or radiation or surgery involving any type of cancer is very, very traumatic. It's emotional and it's confusing and you're scared. And even though people are telling you that everything's gonna be okay, there's always some little part of you that's thinking that maybe it's not. And that personally was a really big part of my issues. And I think that people really need to understand that it takes an entire village. There's not just one nurse, there's not just one doctor. You know, there's a whole team that's taking care of you and putting you first. And it's really important to get to know that team and to be close with them, because they're the ones that are gonna make you comfortable. They're gonna listen to any issues that you have, and I think that's really important.
We built our process at New Mexico Cancer Center understanding that patients like Karina cannot do a lot of things for themselves. And so our philosophy has always been, we're not going to expect the patient to do anything except show up, and sometimes they need help doing that. So we work very hard to have the right team of doctors and nurses and pharmacists and pharmacy technicians and radiation therapists and everybody, because it really takes that whole team coordinating the care and making sure it happens in the right area. But you can't lose sight of the fact that there's a human being behind all that effort, and that they have emotional problems going on because it's scary and it's depressing and you feel so exhausted you can barely think. So we want to be able to help people through that. So we've set up nutrition support. We have working with people for lifestyle changes, for exercise type processes. We have psychologists that we can get to through a telepsych program so that people don't have to travel, but they can have some support along those lines. But most importantly, knowing that when you have a cancer and you're under treatment, if you have a side effect, you need to have it addressed right now. And going to the emergency department and waiting for 12, 18 hours is not right now. So we do make our answers to patients' phone calls within an hour, and we bring them in a lot if they need something. If they're feeling dehydrated or nauseated, we bring them into the office and we treat it so that they never feel sick enough to have to go to the hospital. So we work very hard to make sure that works for patients.